Hello, I'm Dr. Matt Young. I'm reaching out to you from Young Dental SF. I'm here in our consult room, and it's great to be back down at our office. As you know, the pandemic crisis for COVID-19 has really rocked the world and affected our lives in many ways. I hope that you are doing okay during this crisis, both with your friends, your family, work, and health-wise. And hope you're able to stay effective and also get out and do some exercise. I know San Francisco's opened up a lot of areas to exercise, so that's been really good for our family to be able to go out to Golden Gate Park and Ocean Beach and be able to get outside a little bit more than usual. The office has been open. We've been open throughout the pandemic, offering emergency care to patients. And over the last couple months, we've been working on the guidelines more and more to make sure that we're CDC compliant. Spent a tremendous amount of time over the last couple months working on these guidelines. Now we have our guidelines. We call them the return to work standardization for our staff. We've been doing weekly Zoom meetings throughout the pandemic and relating to the team what the updates are. The return to work standardization forms, they don't sound exciting, but they're very thorough. And then once our team goes through them, they are excited to come back down to the office and see our patients and provide a great quality of care. So we've been working hard, and being open throughout the pandemic has been helpful for us because we were able to see patients and not have a lot of patients at the office. So we were able to really work on these guidelines and work on these protocols. In May, we were open 4 days a week. In April, a couple of days a week. In June now, we're back open to 6 days a week and offering appointments for evening hours up to 7 o'clock and also for Saturday hours. So we've been able to increase our protocols and get back to more convenient hours for everybody. I know now that you're getting back to work, this is going to be helpful. Always been at the cutting edge of infection control and technology to help with dental care, and we've gone through our guidelines. Some of the things are social distancing. We're going to have social distancing throughout the office. We're going to have less chairs in the waiting room. Our goal is to get people back into the rooms faster, and we have areas set up where if you're waiting for the receptionist, then you can have different areas for social distancing. We also have the plexiglass set up for sneeze guards to help with the social distancing. We do call it warm social distancing though, because behind those masks and plexiglass and PPE, we still have smiling faces. So you can see the smiles in the eyes, and you know that we are happy underneath, and we call it warm social distancing. In the waiting room, you're going to see that we've taken out the magazines because that can transmit COVID-19. There's going to be Purell hand sanitizer throughout the office that you're able to use. We also have facial coverings throughout the office. Our team will have facial coverings. We have the KN95 masks during treatment. Our patients will have the facial coverings when they come to the office. If you don't have one, we can provide one for you. And also in the operatories, you're obviously going to take your mask off and do the clinical exam and treatment. So one of the key things are that we want to go through our screening process before coming down to the office. All the patients who come through will go through screening. There's about 9 questions on the screening form now. Sometimes it's been a little less, sometimes it's a little more based on the guidelines. But going through the screening questions, make sure that we understand who potentially has a high risk for developing complications from COVID-19 and who may be currently with COVID-19. Our staff also goes through a screening process. We have temperature checks every day for the team, and they go through screening, and then all the patients will go through temperature checks also. One of the things that the city has really opened up is testing through City Test SF. They'll offer testing for everybody, and if you feel like you have any symptoms, you can get tested. If you don't have any symptoms and you're coming down to the dental office and it might be a high aerosol producing procedure, we want you to go through and do the test. So we can talk to you a little bit more about that when we go through the screening process. If you live in a different city, most of the cities in the Bay Area have opened up testing, so you can go to 311.org and usually find information in your site for where the testing would be. Some of the things you also see is that we've removed the water cooler from the office, and we have bottled water instead to reduce potential cross-contamination. We're also doing oral rinses before the appointment. Do oral rinses with hydrogen peroxide. Hydrogen peroxide has been shown very effective to kill viruses, including SARS-CoV-19. There's different mouth rinses like Listerine, warm salt water rinses, Paradex if you guys have had gum surgery or periodontal issues. But those kill bacteria really well, but not viruses very well. But the hydrogen peroxide rinses have been very effective for this. So we want you to rinse for 1 minute with this, and you can rinse with this at home. If you have a 3% bottle of hydrogen peroxide, you can dilute that 1-to-1, so it's not quite as strong. You don't want to use peroxide all through the day. Once or twice a day is enough. But if you're doing it more often, then the hydrogen peroxide can kill all the viruses and bacteria. So you want to use it just once in a while, and when you're down at the dental office before the treatment starts. As you know, in our office, we have private treatment rooms, so you'll have those rooms rather than more of the open bay style. We also have surgically clean air filtration units throughout the office. I started investing in these a couple years ago. These are awesome units. It goes through a 6-stage filtration system with filtration, carbon granite filter, UV light radiation that will expose and kill viruses, bacteria, and mold. And it's been a very effective unit for us over the years. We've increased these, so now we have them more throughout the office and in each operatory. And it also helps to create lighter air. It removes negative ions from the air and makes it more breathable. We also have a state-of-the-art HVAC system with MERV 13 filters to help to filter that air out even more. I've also invested in foggers. Foggers will be able to utilize an HOCl material that's FDA approved to be around people and also kill and contaminate viruses and bacteria. This generates a very fine aerosol to help to kill aerosols that might be in the area. This almost sounds like a vacuum cleaner. So if you hear something that sounds like a vacuum cleaner, it's probably the fogger in use after one of the treatments. We are frequently cleaning the work surfaces throughout the day. You'll see this at the front desk, cleaning the work surfaces, all the doorknobs, all the handles, obviously all the operatories before and after treatment. You know, with all these guidelines that we've put forward, there are still risks with just coming down to the dental office or leaving your house. So we do want you to be aware that there are increased risks of coming down to the office. You want to make sure when you're outside that you wear a mask covering. It could be a cloth mask. You want to make sure that when you're outside within 6 feet of somebody, you have a mask. If you're inside, you should have the mask on. Anybody down at the office should have a mask. You want to avoid touching your mouth and face with your hands throughout the day. Use hand sanitizer. Wash your hands thoroughly throughout the day. Really recommend doing a multivitamin also. Multivitamin will help to your immune system, bolster your immune system, and help to prevent issues down the line. At the office, we're doing more planning in the operatory. We can schedule your next appointment in the operatory. We can schedule your copays in the operatory, and that'll decrease the amount of time that you're at the front desk, and you'll be able to get into the office and get it out of the office a lot faster. As you know, I'm past president of the San Francisco Dental Society and currently on the board for the Dental Society, and also a delegate for the California Dental Association. I've really been on the forefront of all the changes that are going on, the regulations, the guidelines for our dentists, and helping our whole profession to get back on track faster. Two great resources we have if you've been following our emails. The San Francisco Dental Society website is sfds.org, and the California Dental Association website is cda.org. At cda.org. And you can also visit our website at youngdentalsf.com. You can get information on our practice there, and you can also schedule appointments there. Well, we look forward to seeing you soon. We hope everything is going well. If you have any questions or concerns about your visit before, please reach out and give us a call. Thank you very much, and have a good day.